Hello, in this video, I'm going to be talking about 4 foods that may reduce your risk of cancer recurrence. Before I go on, I want to invite you to subscribe to our channel. We're always putting out new content, often in response to suggestions from you, our Yerbba community. It's really important to make clear from the outset that diet alone, that lifestyle alone, that infusions of things that sound and feel natural do not and cannot take the place of treatments we know work through rigorously conducted clinical trials. I wish there were, so let's get to it. So the first category I'd like to start with is the cruciferous vegetable category. These are leafy greens, often very dense foods like cabbage and Brussels sprouts, broccoli, those really crunchy, thick mouthful kind of vegetables. We have a whole other video on how these vegetables may work to decrease the risk of cancer coming back that I'd encourage you to go to. In brief, these vegetables contain a compound called sulforaphane that may reduce oxidative stress in your body, decreasing the oxidative burden on your body and your risk for cancer recurrence. The next type of food I want to talk about are berries, and I mean any berries. These can be blackberries, raspberries, blueberries. They can be fresh, they can be frozen. Berries appear also to decrease oxidative stress in the body, and oxidation may promote cancer growth. So eating a lot of vegetables like the cruciferous vegetables and berries together would be part of a healthy lifestyle that may decrease the risk of cancer recurrence. In the Nurses' Health Study, people who had several servings of berries each week had a lower risk of their cancer recurring in the future. Now, many of these studies are fraught with some confounders. So people who have access to a lot of berries have higher incomes, they have access to food in their freezer, and they may be able to get fresh berries more easily than people who don't. So it's really important to know that people who have access to healthier diets also tend to have higher socioeconomic status, less stress, they live in healthier neighborhoods, they have access to healthy places to play and to exercise, they may have jobs where they have more autonomy. So it's really important to realize that the reason we don't have answers to these questions is because there's so many things, not just after a cancer diagnosis, but leading up to a cancer diagnosis that we can't always account for. The next type of food that can be really helpful are whole grains and legumes. Why do these work? Well, these food products contain a lot of fiber, and fiber appears to improve health outcomes. And this is not just with breast, but also with other cancers. Fiber keeps estrogen levels steady in the body and also helps regulate insulin levels. And we know that a lot of insulin in the body, which gets released when we eat food, may promote the growth of cancer. And so keeping insulin levels steady and keeping estrogen levels steady without big spikes in insulin or big spikes in estrogen may help improve outcomes. I want to make a slight detour and talk about the WELL study. Up here on the screen, you'll see what that stands for. This study looked at people who ate a super healthy diet. We're talking lots of fiber, lots of antioxidants. And in this study of 3,000 women, people who ate this super healthy diet did not have a better outcome. Does that mean what I'm talking about today has no value? No, not at all. In addition to having the possible effects on micronutrients in the body, levels of insulin, levels of estrogen, we know that people who eat a fiber-rich, colorful diet have a lower risk of other things that can complicate the life of somebody who's had breast cancer. Fiber, we know, improves cardiovascular outcomes. We know that keeping a healthy weight with a very colorful plant-based diet is good for strokes. We know it's good for your heart health. We know it reduces your risk of complications from diabetes. And all of these things are important after a diagnosis of breast cancer. So that little detour aside, let's move to the 4th category. The fourth category are omega-3 rich diets. That includes fish, it includes flaxseed, it includes nuts. And we want to be really careful not to confuse you. Check out our video on flax. Check out our video on walnuts. We address what we know about those two types of food, but we do know that a diet rich in omega-3 fatty acids may be helpful if you're looking for something to do to take the absolute best care of yourself. We know that a diet rich in omega-3 fatty acids can be helpful. Diagnosed with breast cancer? Meet Yerbba, your guide to personalized treatment options. Each option is specifically tailored to the unique characteristics of your tumor. Sign up today at yerbba.com to take control of your breast cancer journey. I've covered a lot. I've made a couple detours. I've also started with the caveat that we know that a healthy diet, we know that exercise, we know that many of the other things we consider natural alone are not enough. But it's really important to know, what can you take control of? What can you do to help yourself? And we're hoping that this video is helpful in that regard. Thoughts or comments, drop them below. Help out other people in the Yerbba community. Thanks for watching, and we'll see you next time.